Hello and welcome to my quick win videos all around your newborn baby. 25 tips for the first 25 days. My advice on feeding, soothing and feeling more confident during your baby's first days and weeks at home. So this is tip 10. Now, crying during feeds. Some babies cry and seem unsettled around the time of a feed. So if you're breastfeeding, you may find that improving your baby's positioning and attachment will help them settle. You can go to a breastfeeding drop-in and ask for help, or talk to your health visitor or doctor or midwife. It may be that something you're eating or drinking is affecting your baby. I remember I had too much fruit and it affected my son's feed. If you think this is happening, try keeping a diary of what you eat and when the crying happens. You might find a pattern. And again, talk to your health visitor. Crying during feeds can sometimes be a symptom of reflux, a common condition where babies bring back their milk after feeds. So again, always ask for help. Always speak to your health visitor or GP for more information and advice. We're not born knowing exactly what to do with a newborn baby. It can be very stressful because it's all new and you want to get it right. So never ever be afraid to ask. This is tip 11. If your baby cries constantly, there are several reasons that can cause a baby to cry excessively. It can be really exhausting, stressful and full of anxiety if your baby is one of those babies. And I know that if you've tried everything and nothing seems to comfort your baby, you can get very, very tired. Now, I know my son Will had colic. So excessive crying could be a sign that your baby has colic too. Everyone agrees that colic exists, but nobody quite knows what causes it. Some doctors think it's a kind of stomach cramp. And the crying sounds miserable and distressed, and it stops for a moment or two and then it starts up again, which suggests it could be caused by waves of stomach pain. Now, the crying can go on sometimes for minutes, sometimes for hours, and that can be incredibly exhausting for you. There may be little that you can do except try to comfort your baby and wait for the crying to pass. But tip 1 for colic. Colic actually gets better on its own after a few months. And I know that sounds a long time, but these tips might be helpful in the meantime. So of course, comfort your baby. There is no best way to comfort your baby. Different babies, of course, respond to different methods. So you may have to see what works best for you. You'll get to know your baby and your way of doing things. I'm always about trusting your intuition and your own feelings. But the following suggestions may help. So hold your baby during a crying episode because it can sometimes help, as so can wrapping them snugly up in a blanket or a baby sling. Try holding your baby in different positions, such as on your shoulder, cradled in your arms, or lying with their tummy facing down along your forearm. Sometimes these different positions can really help. Sit or hold your baby upright during the feeding to prevent them swallowing air. Now, there are loads of quick win videos all around newborns and babies, right the way up from toddlers to teenagers too, in my parenting club. So do join that because it's so easy to join, and there are absolutely stacks of my webinars and articles and quick win videos to help you on your journey. So until next time, take care.